Welcome, everybody. This is the 2:30 session of the, I'm going to share with you some Utah medical cannabis law basics, and then we'll also have a more medical specific portion that will talk about the endocannabinoid system and a lot of other specific topics related to the medical treatment of conditions with cannabis. And so my name is Richard Oborn. I work for the Utah Department of Health, Center for Medical Cannabis, and I've been there for about 2.5 years. Prior to that, I was the director for the Office of Vital Records and Statistics at the Utah Department of Health. And then in my past history was I oversaw licensing of pharmacies and pharmacists for DOPL at the Division of Occupational and Professional Licensing years ago. So that gives you an idea for some of my background. I'm not an MD, but I am a regulator, obviously, and I went to the University of Utah. I got a master's in public administration there, and I live in Bountiful with my wife and kids. So anyway, I was glad to get this invitation. It gives me an opportunity to share with you as medical professionals the regulatory landscape that exists in the state of Utah today for medical cannabis. And it's very unique, as you would expect. I'm sure some of you have done a little bit of research or heard from patients or other providers about the state of medical cannabis in Utah and nationally. It's a topic that's getting more and more discussion, obviously, and I agree that it's important to be informed about these things, even if you decide not to recommend it to patients. It's important to know where to recommend them to, where to refer them to if they do choose that as an alternative. And like I said, I work for the Department of Health. I represent the Department of Health. And Dr. Corey Anden, she'll be instructing the second hour. She's here in the front row. And she's not an employee of the Department of Health, but is a local MD who is able to share with you some of her expertise as it relates to study that she's done about medical cannabis. And she's someone that's gone through and gone beyond the typical education about cannabis and gone through some master's level coursework that has given her the ability to even dig deeper and learn about this unique type of alternative medication. So a few things I wanted to make sure of that everybody knew. This course, obviously, it lasts for 2 hours. So I'll be the first hour. Dr. Ann will be the second hour. And there is if you do want credit for this, for purposes of becoming registered in the state of Utah as what we call a qualified medical professional or QMP under the Utah Medical Cannabis Act, that enables you to recommend medical cannabis to patients. And I will talk a lot more detail about what's involved in that and limits to it and things like that. But if you do want to go forward and get registered with the Utah Department of Health, this particular course will help you get one step toward that goal. There's an additional course that if you take, it will help you complete the requirement for that. And the additional coursework, I'll make sure that it's shared online on your website, but it's online and it's at www.answerpage.com. It's a standalone CME for medical marijuana. It's a 3-hour credit course, and it's online. It's a $135 fee that you pay online, and so if you want to learn more, that's a place to do it in order to actually get registered with the state of Utah to recommend medical cannabis. And there's a $100 fee to register. We'll talk about those type of details a little bit later, but that just gives you an idea for a second step you can take toward becoming qualified to actually register with the Department of Health to legally recommend it to patients. And then regarding the test, you can complete the test either online or in person. There's a physical copy of the test there, the ladies there at the front. And you just would need to turn those in at the end if you're doing it in the physical test. And I think there's 8 questions that Dr. Anden put together. And passing of that gives you the ability to get credit for this for purposes of registration with the Department of Health, okay, if you choose to pursue that. So, great. I think that takes care of just 2 housekeeping things I wanted to make clear, and we'll move forward with the presentation. So one thing I want to make sure of is that you all know that my portion of the presentation, it's going to highlight some very general parts of the Utah Medical Cannabis Act. And my purpose is not to be comprehensive about it. There's a lot of content we don't have time to cover. But what I try to do is give you a general outline of the landscape, regulatory landscape, and so you can inform your patients and help them learn more about the products and legality under state law. Okay, and then also you're also welcome, of course, to go to the legislature's website. They have a complete copy of the Utah Medical Cannabis Act. There's fact sheets and responses to frequently asked questions on our website, which is at medicalcannabis.utah.gov is our website. And so you can find information there after this course as well. And also very important to keep in mind that this course is not intended to be legal advice. So I throw that out there as a reminder. All right, so a few things we're going to cover. We're going to talk about the absolute basics. I'm considering this as kind of an introduction to the law. How many of you, do we have any qualified medical providers with the Utah Department of Health that have already registered that are coming to this course to build on coursework they've already done? We've got one here, a few, Dr. Andon, of course. Wonderful, okay. And I assume that most of you are not registered with the Utah Department of Health, so that's good to know as well. We're going to help you build a base today that can just help you in your practice. There's almost 800 in the state of Utah. There's almost 800 qualified medical providers that have registered with the Department of Health, and we'll talk more a little bit later about that group. Okay. We'll talk about the legal dosage forms, the cannabis processors and pharmacy product labeling, the medical cannabis pharmacy locations and standards for Utah, cannabis purchase outside Utah, how that's handled in the state, and then we'll talk about some upcoming changes to the cannabis program. And then, of course, I want to make available time for questions. So I'll make sure we end at about 3:20 is my goal. And that way I can make sure I have time for 10 minutes for questions, and then we'll hand it off to Dr. Andon. Okay, so one of the most critical things about cannabis is understanding that there is a legal difference between products that are often called CBD, also there's hemp products, and then THC products. So if you don't already know, that the difference is the CBD or hemp-based products, they have less than 0.3% concentration of THC. THC is the acronym for the compound in medical cannabis that is psychoactive. So that's why the federal government has decided to separate these. One is THC is psychoactive, and so they've taken the position that because of that, we'll continue to make it federally illegal if it has 0.3% or more concentration of THC. Okay, and as many of you know, it was completely illegal until just a few years ago, until the federal law changed and separated these two. But everything on the left here, on the tan side of the screen, is less than 0.3% concentration of THC. It is federally legal, and most states allow them. Some states just don't have a law addressing it yet, but Utah does. Many businesses are registered with the Utah Department of Agriculture and Food to legally manufacture and sell these products, okay? They do need to be registered and licensed with the Department of Agriculture and Food in order to sell CBD products, but you've seen them all over. You see them at gas stations. and you see them at quite a few places. And there's varying degrees of quality, as you would expect. I think it's akin to essential oils. You'll find varying degrees of quality, and so you find quite a wide range of quality difference between different types of products. So if you know your patients are using this alternative type of medicine, it's important to educate them about quality and how to verify, educating them about asking for certificates of analysis so they can show that it's gone through a reputable lab for testing and things. Really important to ask for those things. And typically, as you would expect, products that are of higher quality cost more money because they cost more to process, right? So just because something's cheaper doesn't mean it's the best one out there. So, okay, and then we've got our THC products. These products can continue to be federally illegal, but 36 states, including Utah, has decided to venture into a state law that makes it legal for under state purposes. Under state law, it continues to be under state law legal. Okay, this law, a little background, it passed by ballot initiative, Proposition 2. It passed not overwhelmingly, but a majority of Utah citizens voted to approve it. And there were certain elements of Proposition 2 that the Utah legislature felt needed to be amended, and so they amended it just a few days after it became effective. And Utah law allows the legislature to do that anytime a ballot initiative passes. Our Constitution and laws are written such that they have that ability, and then if you are upset about them changing it, then the legal solution is to vote the legislators out and choose ones that support what you want. So anyway, very few businesses are licensed in Utah to legally manufacture the products that have higher than 0.3% THC, okay? Yes, there's a question. Oh, okay, you got a friend coming in, great. Okay, so in the state of Utah, they're legally growing, there's 8 cultivators growing medical cannabis with the purpose of 0.3% or more THC concentration being the end product, okay? And then there's 13 processors approximately, and then there's 14 medical cannabis pharmacies. Other states, they call them dispensaries. In Utah, our state law designates them as medical cannabis pharmacies, and they follow a lot of what the Pharmacy Practice Act sets forth for retail pharmacies. There's the same expectations. We'll cover that in a bit in a lot of ways for these 14 medical cannabis pharmacies. Okay, here's the regulatory landscape throughout the United States. It represents a patchwork, obviously. We've got Utah surrounded on the east and west and south by those states that are adult use or recreational use of cannabis is legal, right? So anybody over age can purchase it. Some of them also have medical programs where you don't tax the medical product in those states because it's considered a medicine if purchased by someone that qualifies under their law to be a medical cannabis card holder. And so we've got those recreational states, but then to the north, obviously, we've got Idaho and Wyoming, and then these other states where there's just no program for legal THC right now. So this creates some problems. One of them is just crossing state lines, obviously, with product. Imagine if Utah had to grow all of its own oranges. It wouldn't do very well because it's not the best climate for growing oranges, right? Now, cannabis, there's other states where it might grow better, and they have a lot bigger volume of cannabis over years. I mean, in Colorado, they've been growing it legally for 20 years, right? So they've been doing it for quite a while, and they've got an oversupply and abundance of it, but it cannot legally cross state lines. So important to keep that in mind. 100% of the product that's legally sold in Utah by the 14 medical cannabis pharmacies, it's all processed, cultivated in Utah. 18 states allow for recreational use of cannabis. There's typically these days, there's at least a few a year that join that group. Or adult use, excuse me, yeah, let's say, yep. So adult use, there's typically some that join that. Okay. All right. So here's just the high level, at a very high level, the process that a patient goes through. And we've got locate a qualified medical provider. A patient can go to our website at medicalcannabis.utah.gov. They click on the provider icon, and that will help them find a provider. They're divided by county, and you can find those providers that are authorizing us as a department to advertise their name on our website as a provider that is taking on new patients to recommend medical cannabis. Now, there are some providers that are registered with us that choose not to have their name posted on our website. That's their choice, and they just may not want additional patients right now. They may be an oncologist or neurologist at the University of Utah or something, and they just want to be able to use it in their little sliver of current practice, right? So that's common. And but then we've got others who want to make it a bigger part of their practice, are accepting new patients, like Dr. Randon, and they have been able to make it a bigger part of their practice. And for that reason, they are authorizing the Department of Health to post their name and contact information on our website. Okay, so a patient, though, let's say they hear about cannabis and they're thinking, okay, goodness, I just want to try this. I want to visit with a physician that knows a lot about it. We always encourage that their first step be to talk to their primary care provider if they have one. That's obvious why it's important. You want to let your provider know about all the medications you're taking, including those that might be outside of the typical FDA-approved landscape, right? If you're using it for treatment. So we always encourage them to contact their medical provider that they typically meet with for whatever condition, whether it's chronic pain or whatever, and that they inform them, hey, this is something I want to do. That provider, more and more often, is being educated through courses like this about what some of the options are. And it's very common that that provider may say, goodness, that's something I don't know a lot about, but I know there are other physicians that know more about it, and I might, let's do a referral. There are some physicians, if the condition is chronic pain, there are some physicians that treat chronic pain that are registered with the Department of Health. Let's get you connected to one of those. Or it may cause the provider to actually want to get registered with the Department of Health to be able to recommend it and pay the fees that are involved with that at $100 initially, and then $50 for every 2 years of renewal. So anyway, I think that's the first step. Then we go to making an appointment with your QMP. Before you make an appointment, it's possible that a patient already has gone on to their to set up an identification inside of what we call the electronic verification system, the EVS, to begin to apply. But they cannot get a card until after they meet with the provider. So that step 3 could actually be reversed with step 2. And I think that's typically how it happens. That's what we encourage, is that they go actually before they meet with the QMP, but they could do it after. And then chances are that the QMP, the patient is careful about this, and they're not just there for a quick appointment, but they're really careful about what they're sharing, and there's a legitimate benefit that the provider believes could come from use of medical cannabis. And so the next step would be step 4. The QMP approves the recommendation. That happens online and through the electronic verification system. And that way the provider can do that first person registration or certification of that condition and recommendation. We do have a role of what's called a QMP proxy that allows someone to, as a medical assistant or a nurse at a medical clinic, to do some of this work under the permission and authority of the QMP, the provider that's registered. So they're able to make the job easier of the provider if they arrange for that as a QMP proxy. Then the patient logs back in after this QMP approves the recommendation, and they pay a $15 application fee online. And then it's forwarded to the Department of Health. We review that, we make sure everything's there, we approve the application, and then the individual receives via email a PDF that has a version of the card with a barcode that they can print out. And it has the Department of Health logo on it. And the intent here was, let's not wait for physical cards to be mailed out. Let's let an email go out so people can just get that card in an instantaneous operation of our software. And that allows the patient to print it out or to save it on their smartphone. And with that, they're able to go to the pharmacy and not only show that evidence of having registered, but they're also required when they go to the pharmacy to show their ID. Driver's license is the most common way for them to verify, but they also can use a passport or some other government-issued photo identification that proves that they are who they say they are, okay? And then after that, they can go purchase the medication from a licensed medical cannabis pharmacy, and I'll share the locations of those a little bit later on. But again, this is just high level, and this is only for patients who are 21 and over. Those that are 21 and younger, under 21, so 20 and younger, those individuals must go before what's called the Compassionate Use Board. I'll talk about that a little bit later in the presentation so you can know how those are handled. But are there any questions about this process from the group that's physically here? I know there's people joining virtually, but if there are, I'm happy to answer, or we can save those to the end. Yeah?
Production keeping up with demand?
It is. Initially, like every state, when they start, there was a supply. Yeah, there was a supply concern. And, you know, that's natural. That happens in every state when they start out because you can only grow so much with every crop. And also there was a deadline to launch the program. So there definitely was a supply issue at the very beginning. I mean, I'm not hearing about it so much anymore. There are certain types of products that sell out, and there are other types of products that don't. Very popular is unprocessed flour, or the bud, people call it, of course. And we'll talk about that a little bit more. But also popular is the vaping cartridges, the chewables. Okay. All right, so as of September 30th, we had 37,735 active medical cannabis cardholders, 781 QMPs, 14 pharmacies, 13 processors, 8 cultivators, and 1 independent testing laboratory. The Department of Agriculture would love for there to be more independent testing laboratories, but only one company stepped up to meet the requirements. The equipment, as you would expect, is very expensive. And the personnel are expensive. You want to make sure you don't just have anybody doing that testing. And so that's been, in the past, a bit of a bottleneck is getting things through that testing laboratory. Department of Agriculture has stepped up to do some of the testing as well. But as you would expect, that's an important piece of a medical-only program, is ensuring that the products are tested independently, that they're not just done in-house, but they're done independently, and that there's no connection, unknown between the pharmacy and the laboratory. There can't be any financial connection between the two. It's completely independent. So,
and
yeah.
I would say that more than one lab would be important to assess consistency.
So I think we're hopeful that in the future there'll be additional businesses that step up to take on that role. Okay, so here's what a actual resident Utah resident medical cannabis patient card looks like. Tom Gallagher is a fake name I threw out there, but that's what they look like with the barcode. And this is literally, if someone were to get the email and print it out, that's what it would look like. And so they can also screenshot it, like I said, and have that appear on their smartphone. And so there's the website where people go. The initial card is issued for 90 days. In the future, our software is going to be modified such that that first card is issued for 6 months. The law allows for that, and we're adjusting the software along with other changes to allow for that in the future. But for now, that first card renewal is 90 days, and it's $5 renewal after the first 6 months, and then the subsequent renewals are every 6 months, and that's $15. And then a QMP's renewal of a patient card may be done virtually without a face-to-face visit. That's the renewal, but that initial appointment must be in person, and there has to be that face-to-face meeting. Legislature decided on the policy of, even despite COVID, of requiring that face-to-face meeting. So that's how some of these high-level requirements work out. And then if it's a minor, they cannot purchase product unless they are attached to a guardian, and that guardian must undergo a federal criminal background check. Also, let's say you have an elderly father and he would like a medical cannabis card. You, as a son or daughter, could go and get registered as a caregiver, and that way you would be able to go purchase legally, specifically for that father or mother that is using it. But there is the requirement of the federal criminal background check in those types of cases. Here's a high-level representation of the distribution system. I haven't talked too much about delivery, but it is legal for medical cannabis to be home delivered in the state of Utah. There's currently 3 pharmacies that provide that service, and for a long time it was just one, but the one that continues to do it, they continue to do it statewide, and which is a remarkable thing right now, especially in a state like Utah, right, that has so much rural area. To be able to back that up is a big deal. So that was one reason why the legislature did not want, at least at this point, to go beyond 14 locations, was because they amended the law to allow for home delivery. And so that made it possible for anybody to order from the comfort of their own home, to pay potentially, of course, an additional fee, but we already do that often for having Amazon send us stuff. And so anyway, inventory control system. This is a system that tracks the product from 8 inches tall until it's actually sold. So this is to prevent from diversion. Obviously, in other states, diversion has been a major problem. An overabundance of cultivation and processing has created a black market in states like California and Oregon and in a lot of these states that have been doing it for a long time. And there's a lucrative black market there. So Utah was hoping to address that. One of the ways they do it is through an inventory control system that tracks product from 8 inches tall to patient use. If a product is destroyed, that is documented in our electronic system, and we do audits of the pharmacies to ensure that they're doing what the law requires them to do with product, and that they can prove that no product is being diverted. Okay. Qualifying conditions. I've mentioned how chronic pain is one of the qualifying conditions already, of course, and that is defined in the law as pain lasting longer than 2 weeks that is not adequately managed despite treatment attempts using conventional medications or physical interventions. So the expectation is that a provider will not use this as a first way of treating someone, right? that it's an alternative after other treatments have been exhausted. It should not be a first-line treatment. Okay, but we've got these conditions, a list of which I've given here. I will acknowledge that chronic pain is the most common by far, no surprise, the most common type of condition that people come with a qualifying condition with. It's about 75% of medical cannabis cards are issued to patients that come with a condition is chronic pain. And you can also see that chronic pain is affiliated with a lot of other conditions that don't show up on the approved list. But if the doctor recognizes that in addition to a certain condition, they have chronic pain because of the symptoms that impact their quality of life, that it qualifies as chronic pain, then they're able to qualify under the chronic pain part of the law. The second most common condition is PTSD. But when it's recommended, it must have been treated by a licensed mental health therapist, and it must have been diagnosed by either the VA or through an evaluation by a psychiatrist, a master's level psychologist, an LCSW, or a psych APRN. So it just can't be a regular physician that doesn't have background in mental health therapy or psychiatry. It needs to be one that has one of these specialties, and it could be, an MD that doesn't have the specialty, but then they know that this patient has had their PTSD diagnosed by a psychologist, right? And they have documentation to prove that, then that would then allow that MD to go forward and recommend it if they feel like it's justified. In the minors, autism is one of the most common types of conditions that we see. We see children that are just, very violent and difficult to control with their autism. They've been trying these other medications and treatments, and they're not working, and so they come through what's called the Compassionate Use Board, and they're able to get approved by this group of physicians that's been appointed by the governor of Utah to be on this board of physicians that evaluates the cases of each of the petitions from minors that come in the state. And also, if there is someone who has a condition that doesn't appear on the list of qualifying conditions, that individual can work with their qualified medical provider, their QMP, who's registered by the Department of Health, and they can submit what's called a petition for compassionate use. And under that, it could be, any condition, but this QMP feels like it's still justified that they should be able to get access to medical cannabis with a medical cannabis card. So just because someone doesn't have one of the qualifying conditions doesn't mean they can never get a card. These are evaluated carefully by the Compassionate Use Board. Are there any questions about the Compassionate Use Board or the qualifying conditions before we move forward? Okay, we're going to do a deep dive about the registration requirements to become a QMP. So first,
One quick question.
oh yeah.
That list seemed a lot shorter than the list from a year ago. Has it changed? Oh,
Yeah, there's 2 slides. Yeah, I think about 17 conditions.
Can you be sure to repeat the questions for the people for the screen?
Oh yeah. So a question just came that the list of conditions seemed a little short, and the reason why is because it's split into 2 slides. So,
Question?
yeah.
What's the approval rate on the Compassionate Care Board submissions for minors? Roughly.
It's very high. It's not 100%. The question was, what's the approval rate of the petitions that come from minors with help from their parents and their providers? And my my recollection is right, we've got very few that are denied, but some are just, they don't have enough documentation. It's just not justified sufficiently in the documentation for the board to have a level of comfort to approve it. And so it just hasn't been approved yet. And the provider is given an opportunity to provide additional information. We give those opportunities. So yeah, I'd say the denials are very rare. But what's more common is that physicians may not have provided sufficient documentation yet. So those are more common cases, but I believe I know we've got between 200 and 300 minors who have been issued cards in the state, and better numbers on that are available on our website, but yeah. Okay. Other questions about this topic? Okay. So you cannot only be licensed in another state and recommend medical cannabis to a patient in Utah and have that patient get a Utah medical cannabis card. You have to be a Utah licensed physician, physician assistant, APRN, or podiatrist with a controlled substance license. And so that's the first requirement. Then you got to pay a $100 fee, and then you also need to complete a Department of Health approved CME course. So there's 4 courses that are on our website. I mentioned one at the beginning because it is one that if combined with this course, you would be able to meet the Utah requirement. Yeah, okay. And then you apply on medicalcannabis.utah.gov. And then QMPs, they may recommend medical cannabis treatment to no more than 275 active cardholders at the same time. So that is a unique part of our program. If you compare to other states, most don't have a limit like that, but Utah does. The purpose of that is to, the idea was we want to not make it so there's only a small number of physicians that are recommending medical cannabis in Utah. And the fear was that if we don't have a limit, that would make it happen. That would be the result, is that there only be a few number. The purpose was we want to spread out the interest in this program by educating and having a high number of providers get registered and involved. And one of the best, a good way to do that is to limit the number of active card holders that someone could recommend to. And so others are able to recognize, to fill in the gap for those patients that are still needing to find a spot to get recommended under one of the physician's slots of the 275. Okay, so that's one group of physicians that has a limit of 275. And then there's a second group of physicians that have a limit of 600, of up to 600. And that group is described here. People with their American Board of Medical Specialties certification in one of those specialties that's listed there. And then a QMP cannot engage in all types of advertising, but they may post on their website a Green Cross, a list of qualifying conditions they treat, their registration as a QMP, and scientific studies. But one thing about the law is that it does not prohibit a business entity that employs a QMP, such as a medical clinic, from advertising. So there's a number of medical clinics that advertise aggressively. We offer medical cannabis evaluations, and that is, they do that legally because they are an entity that's separate from the QMPs that they employ. And we don't, at the Department of Health, license or register medical clinics. We only license individual physicians or MDs or APRNs or physician assistants. Okay. Also, a QMP may only recommend medical cannabis treatment to a patient only in the course of their relationship after they have completed and documented in the patient's medical record a thorough assessment of the patient's condition and medical history based on the appropriate standard of care for the patient's condition. So we emphasize that when we train and educate providers, so they can be reminded of that. It's no different than other types of appointments that you have with other types of patients. You need to have a thorough record of the assessment of the condition. Okay, so when a QMP recommends medical cannabis to a patient, they may choose to recommend it with or without what in the Utah Medical Cannabis Act calls dosing guidelines or directions of use. Now, dosing guidelines and directions of use are the law's way of saying prescription, but they don't use the word prescription ever in the Utah Medical Cannabis Act because they leave that to the federally legal prescriptions. The federally illegal is the dosing guidelines for medical cannabis and directions of use, okay? So dosing guidelines, very rarely, and actually I don't think I've ever seen one in our software that names a specific product like you would in a prescription, okay? Most commonly, you'll see a quantity or a range, a maximum that they want to limit this patient at. That's the authority of the doctor and under Utah law to limit that if they choose to. It's called a dosing guideline, okay? And then directions of use are any recommended routes of administration. So it could be that the QMP is maybe they have concerns about a certain patient that's a minor using vaping devices, but they still think that this particular patient could be helped by other types of products. So one option is they could, for directions of use, type in our software that they limit this particular patient from vaping devices or from vaping cartridges, from purchasing those products. So that is possible. And if a QMP recommends medical cannabis to a patient but does not specify dosing guidelines and directions of use, that provider, they may choose, although they're not specifying any dosing guidelines or directions of use, they're just saying, I recommend cannabis to this patient. It's up to them. They have the option of uploading information about that qualifying condition. Reason why that may be of interest is because that way the pharmacist can view what that information says about that particular patient's condition. Because the physician, of course, is the person that has that close relationship of understanding that condition. That's not the typically the pharmacist's role. That's the role of the physician, is to, treat that condition of chronic pain or cancer or whatever it might be, right? And they can share whatever information they feel they want to share with the software that's kept confidential and that is only viewed by the pharmacist. Okay, and then they can also upload information about prior treatment attempts and cannabis products that they may have used in the past, right? They might have said, I've been smoking this for so many years and I'm trying to maybe not do that because I know it's not healthy or whatever, but that's just an option that they have. And then also they have the option of uploading a list of their current medications. And that's something the provider could do in the software. And then a patient's initial visit with the QMP, they typically cost between $200 and $600. Dr. Andon, does that sound right?
Yes.
Yeah. So wide range. 600 is 3 times than 2, so it's quite a bit. Now, I want to emphasize that just because someone is charging more than $200, it doesn't mean they're, ripping off the patient. It could mean that they're spending more time with the patient, right? Because doctor's time is valuable, obviously, and you want to make sure that you're able to help a lot of patients, but you want to throw some value into that meeting. And so some providers spend more time, and so they feel like that justifies charging a higher fee. There's not a limit on how much a doctor can charge specifically for a visit where they're treating chronic pain, where they choose to recommend medical cannabis during that visit. It's the private market, and insurance is typically not billed. Now, I say typically because I think that's the most common way, but in some cases I know of, some physicians, they happen to have a registration with the Department of Health as a QMP, but they treat chronic pain. And they're there to treat the whole patient. They bill it with insurance as, hey, I'm treating chronic pain. This isn't, I bill it with that code, right? And then they choose to bill insurance that way. So the legality, maybe you'd want to consult with your insurance about that before you start doing that, but that's just something to keep in mind. Most of the time, though, providers are charging full price without insurance, and the patient's paying out of pocket without health insurance. Okay, if a QMP recommends cannabis to a patient without specifying dosing guidelines or directions of use, they will be determined by a medical, will be determined by a pharmacy medical provider. And so that pharmacist, it could be an MD or a DO at the actual pharmacy, but if it is an MD or a DO at the pharmacy, they cannot also be registered as a QMP. They could only do consultations for purposes of being a pharmacy medical provider at the pharmacy. So most often it's the pharmacist that's doing it, and they review medical records that may have been uploaded into the software that the pharmacist and the provider have access to, and they go through these steps here. Possession limitations, we're running out of time, but possession limitations, they are an amount sufficient to provide 30 days of treatment on the dosing guidelines that the QMP recommends. So I emphasize whatever that QMP, if they feel strongly about a limit, under Utah law, they have the right to limit their patient to that amount. And the pharmacy is obligated to stick to that, okay? Now, if they choose not to have a limit, and that's their option, if they choose to defer to the state limits, then the state limit is 113 grams by weight of unprocessed cannabis, and cannabis in medicinal dosage form, if it's concentrate or if it's a processed type of cannabis, like a tincture, anything but flower, all those products have a limit of 20 grams of total composite THC. That is a lot of product. That is a lot. And then this represents 113 grams here on the right with that photo. And there's a question.
Is it or and? They concentrate and flower or? They have both?
So completely separate, okay? Limits. 113 grams of flower, one limit. 20 grams of THC, concentrate, total composite THC, a completely separate limit. So they could have 113 and they could have the 20 gram. But I assure you, that is plenty. That is a lot.
We're usually talking in milligrams.
Yeah, I mean, you think about a tincture type thing, right? That's pretty small. It's a little tiny thing. So it's milligram typically if you're thinking about a liquid. Okay, all right, so tablets, those are legal. Capsules, not very common, but legal. Gelatinous cubes, those are very common, very popular. Unprocessed flour, most popular. But one thing unique about flour is it must be consumed within 60 days. If it's not, then the patient cannot transport it outside of their house. So that's one thing unique about flour. It's intended to be a medicinal dosage form. So you get your fill like you would with other medication for 30 days. And you're not supposed to buy more than that, right? So same goes here. If you have it more than 60 days, it expires. The legality of transporting that outside of your home expires. And a lot of people ask, why in the world would people buy flour and not smoke it? Because smoking flour is illegal. So why would they allow this? And the answer is there's vaporization that people legitimately do with a vaporizer. Vaporizers cost money. Some of them are very expensive. There's one called a Volcano that is common, I've heard of. and it gives that immediate relief. As you're all physicians, you know this. It gives immediate impact to the symptom being suffered, right? So I think about epilepsy, seizures, those type of things. There's, I think, definitely, what's that? Migraine, right, good example and very common. So, okay, wax, vaporization, resin, vaporization, liquid suspension is oral, obviously. Concentrated oil, that's like a vape cartridge, very common type of product. Easy to abuse, but legal nonetheless. Okay, transdermal, sublingual, topical preparation. Here's some examples. Dr. Anna brought some examples of a vaping device and a few other things that you can take a look at, but here's just some of the ones that are legal in the state. And here's some that are illegal. So we've got cookies, we've got a joint, we've got what's called a cannabis quencher, and this was a photo taken in California. So you can't have containers that appeal to children. You cannot mimic a candy container. No cannabis outside of a tamper-resistant container. No edibles, brownies, cookies, candy in Utah. Here's an example of what that label looks like. I won't spend time here because we're almost out of time, but here's what a pharmacy label looks like. You got the name of the physician and the customer there. And then here's the list of all the pharmacies in Utah. Obviously, South Ogden is the closest one to here at Perfect Earth Modern Apothecary. And then we've got a bunch of others that are located throughout the state, including southern Utah. The ones in southern Utah didn't open until June of 2021. So that's just, they haven't even been open a year yet. Here's just general information about the pharmacies that you can study later. There's very extreme advertising limitations on them, and that provides some general information about that. They have to all have a pharmacist physically present at all times, similar to a retail pharmacy. That same requirement applies to the medical cannabis pharmacies. And they consult with patients, educate patients. They're the medical provider that's licensed by DOPL. They're at the physical location. And the expectation is that they're experts on the products and that they can make educated determinations about what product a patient should use. Okay, so, and we use the term PIC just as a retail pharmacy does, but a pharmacist in charge is the pharmacist in charge. And if something goes wrong at a pharmacy, then we'll go to that PIC and say, okay, this issue came up, you're in charge, what happened? Okay, Cannabinoid Product Board, this is a monthly meeting that happens of this board. They evaluate medical conditions and how they respond to cannabinoid products. They evaluate dosage amounts and medical forms, studies based on evidence. They take a look at those studies that are FDA approved. There's a lot of survey type research out there that is not peer reviewed or is not FDA approved. A lot of volume of that, and you see that in your own practices, right? But be aware of evaluating the quality of studies that you see out there about medical cannabis and about adult use cannabis. The board only evaluates those studies that have that high level of scientific rigor. Purchased outside of Utah. So a patient in the past could have gone to another state and legally possessed a product in Utah if it was in the dosage form and dosage amount allowed in Utah. But as of July 1, 2021, that changed. And so all medical cannabis legally used and possessed in Utah by a Utah medical cannabis holder must have been purchased from a Utah licensed medical cannabis pharmacy. There's a double standard that applies to those that are in another state that come to Utah and possess product, and they're registered out of state and they possess product in the dosage form allowed in Utah and dosage amount allowed in Utah, but they're here on vacation or something, right? But they possess it. So they can legally possess that. That's a small double standard between out-of-state cardholder and a Utah cardholder. Okay. Public use of cannabis is illegal except for under emergency medical conditions. Here's some upcoming changes to the cannabis program. One I'd just like to take a moment to focus on is that any MD, DO, APRN, or PA may recommend medical cannabis to up to 15 qualifying patients and help them get a Utah medical cannabis card. Now, our software hasn't caught up with that law change, but that, when it does, we'll notify groups like this association, this society, so you're aware of it. But this makes it so you don't have to go through and get registered by the Utah Department of Health. Up to 15 patients, you can, there'll be some criteria that have to be met, but you can make it possible for your patients to take that step if they choose to. Okay. So there's my contact information for our office, and I want to hand things off to Dr. Andon, but we've got, I guess, 2 minutes or so for questions. Yes?
Unimportant housekeeping. Do either of these lectures qualify for our controlled substance education?
You need to contact Doppel about that. I don't think so, but you could confirm that with them. Yeah. People are saying no, so they doubt it does. Okay.
Is that $100 fee a one-time fee instead of continuing education you have to do?
Yeah. So one time is $100 every, that's the first time you initially get registered, and then it's $50 every 2 years. And you can pay that fee online. Okay, other questions?
Just clarification on that 60-day period after purchasing flour.
Yeah.
For patients, is that the purchase date after 60 days, the patient can't bring that product outside their home?
So it's the purchase date that triggers the 60 days. Yeah. Yeah, so that was just clarifying the 60-day termination, legal use termination date is what it's called. Okay. Yes?
Is there a tracking site like Doppel for narcotics so we can see if someone has a card?
There will be. And right now, as a provider, you could email us. We'll verify that you are who you say you are, and we can verify that. But it's manually done. You send us an email, and we'll do it. And there's a form that you fill out. But in the future, the legislature has passed a law that enables us to create a integration between our registration system and the controlled substance database. So the products purchased and the fact that someone has a card, that'll be information that appears in the controlled substance database in the future. So that would be the easiest way to find out. Yeah. Okay. One more question.
If a patient moves out of state, do they have to surrender their Utah cannabis card?
So the question is, if a patient moves out of state, are they required to surrender their Utah medical cannabis card? I haven't heard of that, but it would depend on the other state. I mean, patients, residency is relative, right? I mean, some people have jobs where they move often. And so the idea is that you have domicile here in Utah, and I've known of people that have cards in 2 states. And but you have to have domicile in Utah in order to have a Utah card. And if you're coming from out of state, you can apply for the out-of-state card that I talked about a little bit earlier. There's a 21-day period, and you can have 2 of those consecutively each year for visitors that come and want to be able to purchase in Utah. And they have to apply for it online, and they pay a fee, but they can be able to legally purchase in Utah with that card. Okay. Great. Well, I'll conclude. I'll hand it off to Dr. Andon, and I think you'll find that as you evaluate this topic more, hopefully you'll learn even more beyond what I've shared with you and what Dr. Andon shares with you. But I do thank you for the invite, and we'll shift into our second hour here.